Welcome. Thank you for letting me talk about a subject about which I am very, very passionate. I thought about all sorts of jokes to start this off with, like, here I am talking about scapulonate injuries. Here I am talking about hinged external fixation after complex elbow fracture dislocations. Because frankly, those are the topics that I, as a surgeon, am most comfortable talking about. This healthcare policy, totally different language. But when Obama was elected, I could feel something deep inside of me was, for lack of a better word, wrong. So, to make myself feel better, I got my concealed carry permit and got a Ladysmith. That made me feel a little better. Then Obamacare passed. Well, now I own a shotgun. So if Obamacare comes through to fruition, I don't know what type of arsenal I'll have, but it'll be scary, that's for sure. We're going to try to attempt to videotape this if this talk is of such quality that this will be broadcast by another organization of which I'm a member, Doctors for Patient Care. So we'll see how this goes. That's exactly how it would be done, exactly how it would be done. So without further ado, here we go. This is a very, very long but good quote by Ben Franklin. So if you just excuse me, I'll read it. It's long. To relieve the misfortunes of our fellow creatures is concurring with the deity. It is godlike. But if we provide encouragement for laziness and supports for folly, may we not be found fighting against the order of God and nature, which perhaps has appointed want and misery as proper punishments for and cautions against, as well as necessary consequences of idleness and extravagance. Whenever we attempt to amend the scheme of providence and to interfere with government of the world, we had need be very circumspect, lest we do more harm than good. And I think that's the situation that we see ourselves in at this point. One more quote from the Federalist Papers, which is a nice little introduction. It will be of little avail to the people that the laws are made by men of their own choice if the laws be so voluminous that they cannot be read, or so incoherent that they cannot be understood. So, the Patient Protection and Affordable Care Law. What is it? 3,256 pages? Now, I picked up my Bible, and that's about 2.5 Bibles. And I'm not even good enough to get through my Bible, let alone 3,256 pages of law. It's the largest expansion of federal bureaucracy in U.S. history. There are 159 new federal commissions, boards, agencies, panels, and committees, all designed to make me take better care of you. I don't think so. There are 150,000 new federal employees and over 4,000 new healthcare regulations. Here's a brief, simplistic side, attractive to me as a surgeon, about our current healthcare arrangement. You have physicians, you have allied healthcare professionals, you have therapists, so on and so forth, hospitals, you have your payers, both private and public, and then you have patients. So let's introduce Obamacare. Explode! How does this make me take care of you better? Okay? In the very center, you have the Secretary of Health and Human Services, who is a trial attorney. I can't even address that properly. I will move on to the next slide, but you get the point. Let's briefly, very briefly, talk about the blueprint for Obamacare, Romneycare, passed in 2006. There you go. The short-term implications of Romneycare. Massachusetts has the highest health insurance premiums in the country. Over a 5-year interval between 2003 and 2008, the average healthcare premium increased by 33%. I'm preaching to the choir. I'm a member of the choir myself. I'm a patient myself. Massachusetts, it increased 40%. And this was to attempt to cover the 8% of patients that don't have health care insurance. A Democrat had a moment of clarity. They do. Instituting Massachusetts health insurance reform nationwide will threaten to wipe out the American economy within 4 years. Our experiment has nearly bankrupted Massachusetts, and only federal aid sustained the law. We're being propped up so that Obama can drive a similar plan through Congress. So, short-term implications for the states. Medicaid is a leading budget item. And under Obamacare, 18 to 24 million new enrollees are going to be placed in 2014. By the end of the decade, that number is going to skyrocket to 84 million. Understand, these are the big, big numbers. States only receive 2 years of federal subsidy. Then where's that money going to come from? Medicaid, most of the time, does not even reimburse a physician for the cost of care. So physicians are going to opt out because we can't afford it. You can't run a sustainable business by giving somebody pipes and charging them 60% of the cost. You got to cover your cost. So physicians are going to opt out. There's going to be more usage of emergency departments, and you're not going to see access increase. It's going to be more difficult. The long-term implications, and this is where things are scary. This is designed to fail. It is obviously designed to fail. The HHS, Health and Human Services, mandates what will be covered. That's the trial attorney, Catherine Sebelius. The feds are going to regulate what the insurance premiums are. There are going to be these low penalties if you don't have insurance. You know, some people are going to say, heck, I'll pay the $2 grand and not have insurance. Then when something catastrophic happens, they can go ahead and get insurance. There's a guaranteed issue. There's no caps. Now, just from a business standpoint, and I don't know much about business, I don't know how you can run a business not knowing how high your expenses are going to be. I mean, it's a recipe for disaster. I mean, I'm just a surgeon, and I can see that. So health insurance companies are going to collapse, and it's going to evolve into single-payer national health care. You can look at Massachusetts, and you can see that carriers are exiting the state already. Single payer is always the goal. And then there's even a larger goal behind single payer. We'll get to that. So Donald Berwick, recess nomination to head CMMS. He is a Harvard academic. He has a love affair with the British health system. And I read this, a seductress about which he is romantic. And the British Health Service is the third largest employer in the world, again, designed to make healthcare better. And let's face it, he's a socialist. The healthcare system must ration care, must redistribute wealth. That's socialism, unless there's another definition. And he must decentralize an individual MD decision-making. And I tell you, if I have two patients with wrist fractures, you can't tell me that a bureaucrat's going to know that I need to treat this one this way and that one that way. I know what that patient's, or I should know what that patient's support system is. I'm going to know much more about their medical history. I'm going to know more about the implants. I'm going to know more about my ability to administer the care than a bureaucrat who's never practiced in their life. So Berwick saw the writing on the wall. He resigned. There's no chance of approval in the Senate. And his first deputy, Marilyn Tavenner, is now nominated. Yeah, some people in this room may know her because she was a former Virginia Secretary of Health and Human Services under Tim Kaine. But most of the rest of the 49 states probably don't. And I've gone online and read her little bio. She's already said she's not stopping a darn thing. She's just Donald Berwick with different chromosomes. So, Catherine Sebelius. She's been nominated to be the Secretary of Health and Human Services. She's going to be the second most powerful person in the United States of America. She's the former executive director of the Kansas Trial Lawyers Association. So maybe I can get an opportunity to tell trial lawyers how to do their business. They don't deserve to tell me how to do mine. She will determine the definition of quality and the standard of American health care. She will determine the minimal essential coverage and will be the sole authority to establish the patient treatment and eligibility protocols. Very, very powerful. So people have said, really, is this all about rationing healthcare? Tell me about it. I want to know. Well, there are 3 rationing mechanisms. We'll talk about these briefly. The Federal Coordinating Council for Clinical Effective Research. Yes, I have to stare at my slide because I can't figure out what all these things are. This is the rationing board. This was actually begun during the grand stimulus bill, crammed in there. Okay? It's a 15-member politically appointed board put into place by the president within 72 hours of passage. What this council does is it calculates comparative effectiveness. So it'll take the cost of a certain treatment and it'll divide it by the number of years of benefit. And this is very similar to the British NICE board and their quality adjusted remaining years. So these little numeric ratios will determine whether or not you receive treatment. Yeah. I mean, all of these kind of combined all do different arms of, quote, death panels. Really, I mean, now you have the National Coordinator for Health Information Technology. This is the enforcer. And this board will institute the decisions, and it will guide medical decisions at the time and place of care. Can we say this is why we all have these mandates to go on electronic medical records? Physicians and hospitals who are not meaningful users over time will face penalties. These penalties can include being excluded for participating in insurance exchanges, fines, and there are some who believe that prison would be an opportunity as well. Now, this board has gotten some attention in the press, or at least in the medical press, the Independent Payment Advisory Board. Bless you. IPAB will develop proposals to reduce per capita rate of growth in Medicare spending. Okay. Now they determine covered services and fees. So maybe I'll get paid $20 for a carpal tunnel release. Okay, you can see why a wait is going to exist for getting certain services if the fees are again cut to the point where you're not covering your overhead. IPAD is an unelected, politically appointed board. Okay, so exactly, it is uncontrollable. There's no congressional oversight, and the future Congresses will be bound by the current rules, and it can't be challenged by the courts. It's just a board that he created. Well, how many things do we see going on right now that are totally unconstitutional? Ironically enough, I'm gonna go off to a little joke. Maybe one or two of you know that I like to work out occasionally, and I really like P90X. Okay, I've done it 3 times. You wouldn't know it because I've gained 10 pounds in the last 3 months. But anyway, I just started P90X too. I was the first one to sign up for it. And you know what this morning's workout was? Balance and power. I thought, boy, this is a great workout to do, going and giving a talk on this. Why can't we have balance in power? An IPAD is not balance and power. So rationing, it's inevitable. If you look at the current physician supply and demand, 25,000 physicians are graduating each year. 35,000 are retiring. And that's just right now. That's before Obamacare comes in and scares a bunch of people off. In Investors Business Daily in September 2009, they did a study. 65% of doctors were opposed to Obamacare, and 45% of them would consider retiring. I'll tell you, that is not inaccurate. I'm not old enough to retire. I'm in a difficult position. I'm envious. I'm envious because that would be the easiest thing to do. Just kick my husband out, make him go to work, and I'll just take care of the kids. So we're going to look at Barack Obama. He's adding 32 million patients, 30% increase in Medicare enrollees within the next 10 years. You're cutting Medicare, $586 billion. You have a critical shortage of physicians already beginning. And then you got your rationing board, IPAD, making decisions. You can't say that there will be no rationing. And you cannot say that adding a huge level of bureaucracy is not going to make that rationing worse. So socialized medicine, people say, okay, socialized medicine is not so bad. I was in the military. I've had no problems obtaining medical care. That's what one of my friends who was an intelligence officer mentioned on Facebook. Let's look at socialized medicine just very, very briefly versus our health care currently. So we're going to look just at a couple of figures between the UK and Canada and us. Let's look at mortality rate for cancer diagnosis. Well, in the UK, mortality from breast cancer, 88% higher. Prostate cancer, 604% higher if you're in the UK. That's because you have to wait so long to get in, and they probably don't screen. Now, if you look at Canada, mortality rate for breast cancer is only 9% higher, and prostate 184% higher. But you save money somehow, not at all. So let's look at innovation in medicine. The top 5 hospitals in the United States conduct more clinical research than any other country in the world. How's that going to be improved? Since the mid-1970s, the Nobel Prize in Medicine and Physiology has been awarded to more Americans than recipients from all other countries combined. So let's look at the uninsured. Because I'm a physician. I want to help people, okay? And I don't turn people away based on paying status. I just take care of them. And we want to know, who are these uninsured patients? Because this is why Obama wanted to pass his program. Okay, so let's look at the facts. Let's look at the bottom half. Individuals earning more than $75,000 per year, I think they could get health insurance. That's 19%. If you're eligible for government programs, there's another 20%. And if you look at those that are eligible for employer-sponsored, I'm going to trip over the flag, insurance, there's 13%. That's like a little over 50% of patients out there who could get insurance that don't. Then you have your illegal immigrants, and then you have 12 million Americans without affordable options. 12 million. I'm not going to say that's it, but out of 47 million, that's a small amount. So these 5% are chronically uninsured. 85% of Americans were satisfied with their current insurance. And an analysis in April 2010, by 2019, after full implementation of Obamacare, you're still going to have 23 million, or twice that 12 million amount, that are still uninsured. What does it solve? Right. You turn the entire healthcare system down to cover the 5% who fail to get insurance on your own, and then you don't even accomplish that. American healthcare is the envy of the world, and our political leaders have ignored the facts to achieve their goal. Their goal is a single-payer system. This breaks 2 promises of reform. You do not attain universal coverage, and it fails to bend the cost curve down. It jacks it up. So, why is this sure-fail abomination being forced upon us? Again, I'm a surgeon. It just seems obvious. It's the most logical step toward socialism. And Reagan, in 1961, has an exquisite 10-minute YouTube on why socialized medicine is bad and why it's the next link to socialism. I would invite all of y'all to YouTube it. It's wonderful. So, long-term outlook for Medicare. Trustees say it's going to be bankrupt in 2018. $38 trillion. I can't wrap my brain around that number. In unfunded obligations. And Obamacare has stripped another $586 billion from it. 10,000 baby boomers turn 65 every day. And our life expectancy, at least for the time being, is increasing. That will change. Now, I have to just give due thanks, because I'm not smart enough to put all these slides together. There's an organization called Docs for Patient Care. And there are some dedicated, if there's such a thing as a grassroots physicians group, this is it. It And they put together these slides. I've gone over them. I've researched the stuff myself. I've talked to the executive board members myself to kind of go over everything, make sure I understand it. And it's fantastic. If you guys want to give to them, you want to join? If you want to join. Well, yep. This part costs no money, and you get the information. You know, and if you like them on Facebook, you can get the information. It's good. It's good information. It really is. And just a brief couple slides on how it started.
I think I have a link to it on Tea Party.
Oh, excellent. Thank you very much, Dave. It started in 2009 as a result to Obamacare, and developed to try to give some good alternatives to Obamacare. And we believe in the sanctity of the traditional physician-patient relationship, where I feel like I talk to you, I'm going to know how to treat you best, okay? Supports healthcare reform efforts that preserve the autonomy of physicians and patients in healthcare. So these are some ideas of sustainable reform. Number one, insurance reform. Number two, medical liability reform. And number three, a healthy dose of personal responsibility on the behalf of patients. Health insurance. It wasn't tied, probably most of y'all know this, but it wasn't tied to employment until World War II. It was additional incentive when they had these caps on what they could offer workers. Okay, we can't offer you any more per hour, so we're going to offer you health insurance. And now we're trapped. It's not sold in a true free market system like auto insurance, not across state lines, and is heavily regulated by states, and it's burdened by these legislative mandates to say what has to and what can't be covered. And there's a lack of competition, and the presence of these mandates drives the costs up, and these costs aren't transparent. I mean, I'll admit, I'm a surgeon, I'm embarrassed when somebody comes in and says, okay, I don't have insurance, how much does it cost to have this ganglion taken off? I said, I don't know. I can give you the code for it, and you can talk to our financial counselor. The cost should be transparent. They really should. So true insurance would cover the risk of catastrophic loss. For example, like if your house burns down, same type of thing. Health savings accounts and high deductible health plans are a way to put the policyholder, the patient, in charge of their money and their care to make the right decisions for them. This is owned by the individual or family, and the insurance company is responsible to the policyholder, not to the company, that the employer. Is this addressed in Obamacare? Of course not. Insurance reform should include eliminating interstate restrictions to the sale of health insurance. Give the same tax breaks to individuals as are given to employers. Create high-risk pools for pre-existing illness. Small businesses and individuals should be able to pool together. And again, increasing usage of health savings accounts. For those of you that aren't familiar with health savings accounts, they are accounts where individuals can allocate a portion of their earnings in a tax-free investment account. And you can use this money to pay for smaller expenses, leaving your high deductible, low premium insurance to cover the catastrophic type of illnesses. And it brings direct incentives to consumers to control the cost, because you're paying stuff out of your HSA, you want to know exactly what you're paying for. You want to know that if you could get an MRI for $500 less someplace else, you should do that. And this provides freedom and healthcare choice for every person. It empowers the individual and empowers the patient. The quality of care has been shown in HSAs to be maintained. Yes, Joan? May I do it at the end since we're trying to record it? Thanks. So HSAs, the quality of care has been shown to be maintained. You enhance consumer choice. It's portable, so it can go with you despite your job, state to state. Reduce healthcare costs everywhere where it's implemented. And you keep what you don't use. So there's been a study at the MacConnect Center for Public Policy where $200 billion a year would be saved with the HSA. Treasury Department itself showed that yearly healthcare costs could decrease on average 30 to 40%. And you have increased use of preventive care by 20%. In this example of an HSA, you can just Google it, you can look it up, published in the Wall Street Journal, March 2010, where it does just that, where Indiana state employees were encouraged to use an HSA. Cut costs, increase use of preventive care. It's all about empowering the individual. Tort reform. I will limit myself with this. It's conspicuously absent. I mean, we know why. I mean, I think I looked at the stats. Around half of Congress and Senate are lawyers. Okay, you talk about what's it called, conflict of interest. Okay, yeah, exactly. Defensive medicine costs about $150 to $200 billion per year. Absolutely. It adds $1,700 a year estimated to a family policy. That's money better in our pockets. Instead of having folks like Catherine Sebelius trying to tell me how to practice medicine, we should have something like medical specialty courts, where the courts determine the merit of the case and the money based on an expert panel, and have caps on non-economic damages. New Zealand has a great system, okay? They don't utilize lawyers at all. And this is something where, honestly, we as physicians have been remiss on being more proactive at developing. So hopefully we can. Medical specialty societies should determine the best practice guidelines, not bureaucrats, okay? And there are some various state models for reform: California, Texas, and Mississippi. New Zealand as well as a country. So a little dose of personal responsibility. Patients are using HSAs or have the ability to purchase their insurance policies on their own. That's a reasonable cost. They're going to choose the best policy for them. Okay? And since in the HSA is the patient's money, you're more engaged, we're more engaged to choose treatments carefully and control costs, and then the patient gets to keep the change. Along the lines of personal responsibility, we have to mention that we lead the world in many, many great things. Not so great things such as obesity, tobacco, and alcohol use, and I think also violent death, if I'm not mistaken. Obesity-related diseases cost $180 billion a year. Tobacco-related disease, $75 billion, and it's 14% of the state Medicaid budget. You know how many patients I see, Medicaid patients that come in, they got their cigarette, they smoke 2 packs a day, and they got their cell phone. Priorities. I know it's addictive. Preventable injury costs $150 billion per year. So, other determinants of individual early death: lifestyle and behavior, 40%, genetic makeup, 30%, social and environmental, 20%, lack of access to medical care is only 10%. So, a promise. Obamacare is going to reduce family premiums $2,500. CBO estimates $2,100. We've already seen increases. It's only going to cost $93 billion. The actual estimate is around $2.5 trillion. It's going to reduce the debt $138 billion, and it's going to increase the debt. So you might have an insurance card that has about the same value as our little HRTP membership card, but don't think you're going to get any better access to care. It's going to be decreased access. You will have decreased choice. You're going to have increased wait time, decreased quality, and increased cost. Rationing by a trial lawyer. So, fortunately, the health care law only affects two types of Americans: patients and physicians. I guess I'm two people because I'm a patient and a physician. And we really need to work together, not only to get health insurance right, but also to try to keep our country from the march towards socialism. So the various things you can do if you want to get information. This talk, about 80% of this talk is on the Docs for Care patient website with all the information. You could also get a lot of information just by friending them or me, because I'll see a lot of their stuff and repost it. And you can join the Alliance if you want to get little updates. And you can make a donation. You can make a donation to Hampton Roads Tea Party. You can make a donation to Docs for Patient Care. Unfortunately, there's big money against us. And as much as it pains us to put money in, that's what it's going to take. Educate. Educate your friends. Okay? Educate your friends. I didn't know half of this stuff, so I started talking to my brothers and started getting engaged in the Docs for Patient Care organization. Become a community organizer like a certain BO guy. So if I could boil it down to 2 things: educate and vote. Educate and vote. Get your friends to vote. Get your friends smart on this stuff. And I appreciate the time to speak about this topic about which I'm very passionate about. Thank you all.